And thank you so much for joining us. We have, you may recognize him from one of my prior shows, Nathaniel Mulcahy, Dr. Mike Pappas, and Adam Cooper. So I'm going to kind of let you guys introduce yourselves because I know you each have kind of a list. And so it's easier that way. So the first question you take, you can just kind of introduce yourself as well. Um, the first question I want to send is to Dr. Mike Pappas. And I want to address this and then give both of you also the option to follow up. Um, so, Mike, you know, the reason I had to have you was I saw a few videos on your take. You are a doctor in New York, and you did some videos on the capitalist system and witnessing what people are going through during a pandemic with lack of healthcare and such. So, can you just kind of describe what that's like as a doctor to see, and as a self-proclaimed socialist doctor, to see what what is happening in where you practice?
Yeah, so thanks for having me. My name's Mike. I am a family med doc, formerly trained in New York City. I also am or am about to be a psychedelic medicine practitioner in New York City. I am a revolutionary socialist. I write and am a member of Left Voice, which is part of an international network of publications in countries around the world. Um, so, yeah, I mean, to answer your question, I think that first, I'd like to say, to be completely transparent, I'm not currently practicing medicine. I actually stopped practicing medicine partly because of what I saw during the practice of medicine during the pandemic. I think I was working in both the hospital setting and outpatient clinic setting at the peak of the first wave of the pandemic. I had already. It's not like my politics kind of changed during the pandemic. The only thing that really happened is I was even more convinced of my politics watching how the healthcare system functioned during the pandemic. I would say that basically the what we saw was that the COVID pandemic specifically just highlighted, especially in the United States, how we have nothing of a public health system whatsoever. What we really have in the United States is we have a healthcare system that functions inside a capitalist economic system to at the crux work to try to extract monetary value from bodies that are damaged by capitalism. And that's what we saw basically during the pandemic. And that's part of the reason why in no way, shape, or form were we able to respond appropriately to the COVID pandemic and how it spread. I guess I the I I think that what ultimately we saw happening, just to like, I guess first, just let me start with how the pandemic unfolded and those types of things really quickly. I think that it's important to recognize that the pandemic was predicted, it was completely avoidable, and it sure as hell didn't have to play out at all the way that it did. It was created by the dynamics of capitalism. It was allowed to spread, and the dynamics of capitalism actually allowed it to spread even worse than the way that it did. Throughout, we saw what I saw patients coming into the clinic who got sick because businesses were forced to stay open, industries weren't made to be safe, people were forced to like work in close quarters nonstop, kids were sent back to school when they still weren't safe, and all of that was because capitalists need to exploit people's labor for profit. And we're even seeing that now continue to happen today, which is so troubling for me as a healthcare worker, because in today it's basically been that bet who really cares about it? We're just going to let it spread uniformly throughout the population. And I think that really what we've seen is that the only thing that's been learned from this pandemic is that the ruling class has looked at multiple ways, which I think we'll get into more, to exploit this pandemic to increase their net worth and to make more profit, and how we've seen how incapable the capitalist system has been to respond to crises of its own creating. And we've also seen how willing capitalists are to sacrifice lives at the altar of profit.
Spot on. And also that brings up the point that, you do hear people say that, you're getting vaccinations for free. Okay, you are getting it for free, but let's be transparent. Pfizer has made billions off of what they're donating to you. So I think it's really important that people keep that in mind. They're not being charitable. They're not doing something to help people. They are literally saying, with every single person that gets a vaccine, we are raking in dollars. So, and I'm not saying don't get it because of that. I'm just, I'm proving the point that we need to think deeper than what's on the surface. Adam, would you like to respond or add anything?
Yeah, everyone, my name's Adam. I use he, his pronouns. I'm a PhD student at UC San Diego, where I study the emission of pollution from the ocean. We often think of it as a sink, but I see it as kind of Mother Earth's revenge. And a lot of times we're breathing in those pollutants when we go to the beach or when we live in coastal communities. I think on this point, another important aspect of the COVID-19 pandemic is just the massive health disparities caused by prior environmental injustice, especially through exposure to air pollution. So we really concentrated certain working class portions of our country into areas with high industrial activity, and those same populations, mostly BIPOC folks, were forced to go to work, forced to get exposed, not given the proper PPE, not given good masks when we knew that's what they needed to do to avoid exposure to COVID-19, especially before the vaccine in the early stages of the pandemic. And so, yeah, asthma rates, prior exposure to criteria air pollutants had a strong correlation with those negative health impacts.
Absolutely. Nathaniel.
Yeah, so I'm Nathaniel Mulcahy. I'm an engineer and a scientist. I run a humanitarian company called World Stove. And we deal with a lot of crises internationally. And from an environmental aspect as well, I've written environmental policy now for 16 years and have been part of the climate conferences at the UN because of that. Touching on one thing you mentioned, Joy, is certainly Pfizer is making profits, and the fact that the patents have not been released and have not been freed is one of the primary culprits of the spread of the pandemic. There's just not been enough vaccines, and by insisting on making profits off of them, we've allowed the thing to spread. Mike made a point that it has spread quite a far way, but at this point, it is now irretrievably spread. We've now seen jumps from species. So we're past human spread. It's jumped to deer. It's jumped to deer mice. We've now documented at least 3 cases of deer to human transmission. So at this point, there is no way to eradicate this virus. And the latest version of Omicron is at least as contagious as measles, which was up until now the most contagious thing out there. So we've dug a hole so deep that there is no escaping it. And yet we continue to pretend, and it's not just profits, which all of you have touched on at some point, but it's also political numbers. Because if you look at England, 3 weeks ago, they said, we're back to normal. All mandates are lifted. No masks, no distancing requirements. 3 weeks later, shockingly, huge spike in cases, huge spike in mortality, huge spike in infections. And England has always preceded, throughout the past 2 years, the United States by 3 to 8 weeks. So what we're seeing happen in England, where Boris Johnson wanted a little bump in his polls because he needed it, Biden has done the same exact mistake, and I predict in 3 to 8 weeks we will see the same spike in mortalities and hospitalizations, where already the hospitals are overfull. So I mean, it is the level of vile evilness, and right now they're saying we're back to normal. Excuse me, in February 28th of 2021, there were half as many mortality cases due to COVID as there are now. So when we had to lock everything down, we had half the number of cases, even though only 18% of the people were vaccinated at that time. We're now at 69, 70% vaccinated, and we have double the number of cases. But let's lift all the mask mandates. It just makes no sense whatsoever. It's just an illusion that they're trying to create. But the death rate is not an illusion. The mortality, the millions of people who are going to be mourning the 1 million lost people are not an illusion. And yet we're back to normal. How does that make sense to anybody?
Yeah, absolutely. Adam, I know you wanted to talk about, I digress slightly, but you wanted to discuss the use of plastics. And this is something that I've learned so much about being in Pennsylvania with the Keystone pipeline and everything. Would you like to address that and just kind of give people a background on just how much using plastics is involved in deteriorating health and environment?
Yeah, so there's an exercise I like to do. So if you'd all like to join me and take a deep breath in and a deep breath out. So very likely you just breathed in a micro or a nanoplastic. They're all around us. They come off of our clothing when we wash them in the washing machine. If you're next to a road, the abrasion of tires sends them into the air. And if you're on the coast, all the plastic pollution that is accumulated in the ocean gets emitted as microplastics from sea spray aerosol. We ingest around 5 grams of plastic every week. That's about the amount of plastic in a credit card. Scientists have coined a new term for this. We call it the plastosphere. It's no longer just the ecosystem, the biosphere, but plastic is an integral part of Earth's system, and it's all man-made, and it's all due to us. And as a young person, that's terrifying. And we still don't know the full public health ramifications of it, but evidence and the scientific literature to date has pointed towards really nasty chronic long-term effects, especially on endocrine disruption, disrupting hormonal systems, disrupting pregnancy, disrupting childhood development. And so we probably don't observe the full impact of this crisis until we can monitor those populations being born now, just growing up exposed to all of this plastic. And of course, it comes from something. It comes from petrochemical feedstocks. The same feedstocks, the same oil drilling, the same fracking that makes fossil fuels causing the climate crisis is generating this plastic crisis. And because we're living in a capitalist system where you can't strand those assets, you need to keep on drilling. I was shocked and dismayed to see President Biden calling for more oil drilling in response to the Russia-Ukraine war. So as we shift towards cleaner energy systems, we're just exponentially increasing the amount of plastic that we produce. We don't manage it well. We use a lot of it for only one time before we throw it away. And we're going to see a growing crisis that many believe to be the next major environmental crisis if we're somehow able to address climate change first.
Absolutely. And being in Pennsylvania, we have pipelines. I think we're the second highest pipelines as far as states in the United States. But we have this place called Conestoga. It's outside of Hershey, and it is indigenous land, shocker. And it has so many pipelines. I've been there to protest. They literally look like water slides. I'm not kidding you. They are bright orange plastic. They are on school children's property, playgrounds. They're on people's personal property where their homes are, and they cannot fight it. But just the amount of plastic in those pipelines, I cannot even fathom. So you're absolutely right. That's something we definitely need to think about more. And then Nathaniel, I know that you unfortunately have had an experience with lead poisoning, and you have the most adorable 5-year-old twins. So can you share your story about what they're going through?
Absolutely. So, and yes, I will confirm they are the most adorable.
Yeah.
Yeah. So, to begin, we hear a lot about Flint, but Massachusetts has many towns, Malden being one of them, where the lead levels are much, much higher than even Flint, but it gets almost no press. Mainstream media and the political parties decided Flint was a good political image, and from Obama to Clinton to anybody else, they've showed up at one point or another, and not done anything, of course, but it's the obligatory photo op that any campaign seems to do. That said, we were very, very lucky. After a long time, we thought we couldn't have kids. We finally did after 12 years, which was a joyous occasion. They came very early. They spent 2 months in NICU, so they were already fragile, and Federico, our son, is immunocompromised. But when we finally got home, we decided we'd move out of our old house and move into a new house to give them a nice, clean, safe place to grow up. The people who sold us their house lied and sold us a house which the state had issued a hazard warning on, which makes it illegal to sell the house to anybody with children. There is zero enforcement. There's zero consequences. They just lied. The consequences, however, not legal, but they are medical, and both our children became severely lead poisoned. In terms of numbers, and Mike, you'll appreciate this. The current belief is anything, or the current legal definitions, anything above 5 parts per million in your bloodstream will result in permanent neurological damage. The reality is, scientifically, any measurable amount of lead in your system will cause permanent neurological damage. But right now, the laws are a little behind schedule. They're at 5. Our daughter clocked in at 26, and our son at 48. The reason our son was so much higher is our daughter learned to walk sooner. And so she was on her feet rather than our son, who was on hands and knees, and from hands to mouth ended up becoming much more poisoned. The state evicted us from our house, threatened to take our children from us, all because we were living in a house that's illegal to be occupied with children, and we didn't know the people who sold it to us. I've been an activist my whole life. In terms of time frames, my first real political rallies were with Abby Hoffman and Amy Carter. So I've been in the game of activism for some time. And so as a scientist, a parent, and an activist, I wanted to find out how this could happen to our kids and why is it happening. And I found out that Massachusetts has such outdated laws regarding lead poisoning that they've allowed the creation of a loophole which exempts health insurance companies for covering the treatment of lead-poisoned babies. That seemed like a simple enough solution to close. So I wrote a bill. Not one Democratic representative agreed to co-sponsor it, despite the fact that we had 6 of the world's recognized experts from the Harvard Lead Summit determined that these were the changes that needed to be made to make lead legislation up to date within Massachusetts. Not one could sign it. After a huge battle, I managed to get 2 people to sign them, neither of which were Democrats, both Republicans. So, this whole vote blue no matter who baloney. Why are we not just voting for things that are protecting the environment and children? And how can you not vote for something which prevents babies from being poisoned? I mean, it just blows my mind. So when I tried to get them to sign this, even my local representative refused to sign it. And when I asked why, she said, because nobody goes against the health insurance companies in this state. I mean, number one. So I said, fine, I'll take a different approach. In the same way that when your car doesn't pass inspection, you have to have a big R on your windshield until you fix it. I said, great, we'll write a new bill which requires any house that doesn't pass inspection to get an R saying lead poisoning can't sell to babies on the front door. That cannot be removed until it's remediated. The response that time, nobody in the state goes against the real estate lobby. So capitalism is allowing children to be poisoned willfully because nobody wants to lose profits on a house, and nobody wants to go against the health insurance companies because we get so many donations from them. I mean, the Congressman Richard Neal, who is the congressman in Massachusetts 1st District, receives the highest number of contributions of any member in Congress from the health insurance lobby. So he's been, despite Massachusetts' illusion of progressiveness, he has been one of the main obstacles to Medicare for All. And it's because why would he want to give up the donations?
Absolutely. Yeah. I mean, he has the ability to literally call a floor vote on Medicare for All. Because what do we have? Like 125, 135 signatures of reps? Yeah, I support it. Okay, what you doing about it? Because most of y'all don't even so much as tweet about it and use a hashtag. So you're right. We actually had an action. I came up with the phrase. Thank you very much. Don't be a dick, Neil. But essentially, people went to his house and, demanded that he hold a floor vote. What are you scared of? Just a floor vote. That's it. We want people to take a stand. Are you with this or are you not? We want it on record. Couldn't even do that. So, yes.
Yeah.
Huge
but Joy,
obstacles.
you picked the perfect target, and what's worse is the mass Dems are protecting him. So when in the last election cycle, Morse challenged him in a congressional race. Morse is the mayor of Holyoke, who had done a really good job of improving Holyoke and had done really remarkable work. He challenged him, challenged Richard Neal to be primaried. Weeks before the primary, a scandal came out which accused Morse of all sorts of sexual improprieties. It was a huge blow to his campaign. Of course, he lost. And weeks later, it turns out the head of the Massachusetts Democratic Committee, Gustafson, no, oh dear, it'll come to me, was responsible for it. He confessed to it. He apologized for it. And then days later was almost unanimously reelected as chair of the Democratic Committee. So, right.
I don't know why anything surprises me anymore. Mike, would you like to add anything? And also, as a doctor, have you yourself personally witnessed anyone who has those effects of, air, water, or any kind of environmental cause of health issues?
Yeah, so a couple comments. I think, so first, Nathaniel, hearing that story, I'm really sorry to hear about that. It's ridiculously infuriating that we live in a society that can both allow someone like Jeff Bezos to accumulate the wealth that he has accumulated, and we also live in a society where somebody cannot live in a home that their children are just safe from lead poisoning in 2022. But reflecting on what you said after writing those bills, seeing the responses, those types of things, reflecting on that, from that to what Adam said about, seeing the Biden administration push for even more oil drilling and let's just face it, more environmental destruction in a time when we are seeing pending climate collapse, species extinction, and then all of the health effects of basically what's downstream of the capitalist system's functioning. Seeing like those types of things and how they're functioning today is combined with another thing that Adam, what you said about, looking at how the environmental pollution affects people's general well-being. I saw that in New York, for example, where I was working in a clinic in the Bronx, and a lot of people were coming in affected by COVID, and the Bronx is one of the most polluted boroughs that there is because highways were just built right through the Bronx, basically a form of environmental racism. The point that I want to make about all of this is whether it's in what's happening in the Bronx and what happened in New York or what Biden's doing, that's all happening under Democratic administrations. I think that's super important. There's this idea that the Democrats are somehow our savior, and every time that there's an election cycle, they just pit the Democrats, kind of hold people hostage and say, oh, well, if you don't vote for us, then look at who you're going to get. And I think that we need to come to a conclusion that the Democratic Party is a capitalist party. The Democratic Party does not care about the general well-being of the public. They are a capitalist party with just a few more bells and whistles that have been able to weaponize progressive rhetoric to be able to get votes and actually to be able to stifle and shut down working class movements that would actually push our society in a progressive direction and actually challenge the downstream effects of the capitalist system and potentially the capitalist system as a whole. So I just wanted to say that as one thing. And the other thing, to more directly answer your question about what I've seen, is it's not just, what I've seen in the healthcare setting is not just the result of yes, it's a result of the environmental effects and a bunch. It's a result of a conglomeration of things basically that affects an individual's health. I think that what the healthcare system does very well is individualizes rhetoric around systemic problems. So we saw that during the pandemic, all of the individualized rhetoric, you need to wear a mask, if you don't get the vaccine, it's your own problem, you need to do this, that, or the other thing, to when when it comes to diagnoses, well, you have COPD or your lungs are being affected this way, or those types of things. Everything is individualized. It's partly individualized because then that makes illness commodifiable and then hence able to be profitable basically in the healthcare system, the way that it functions. But I think that it's important to recognize that what we're seeing in the result of individual health, community health, societal health, and then the health of the general world and biosphere is a result of the violence that exists inside of the capitalist system itself. The way that I talk with my patients about this is we slowly over time go from, okay, well, what's affecting you to, okay, well, what's your workplace like? We get into conversations about alienation in the workplace, the Marxist terminology of alienation, how that affects not just your physical health, but your psychological well-being, how you're divided against your fellow worker, how the boss and capitalists basically in general tried to divide you against each other so they can continue to exploit you. And I think that having conversations around those types of things are super important. We try to get to conversations around, it's a term that Engels spoke about, social murder, and how I think that basically anything that from what happened during the pandemic to what's happening with the environmental destruction that we've discussed, it's a form of social murder that's actually being perpetrated by capitalism. These aren't passive things that are happening. These aren't, oh, well, they like to use a lot of in corporate media, passive terminology. It's just such a darn shame that we have a pandemic. It's just such a darn shame that this thing is happening. These things, they're actively being occurring, and they're actively occurring through the violence of the capitalist system. These crises are built into the capitalist system. It's part of the DNA of capitalism. There was the last thing I'll say is there was this terminology from the 19th century. It's a Marxist theory of that there was a state of wars, crises, and revolutions. I think that we are in a state of like a uptick of wars, crises, and we're seeing more rebellions than revolutions currently. But we're seeing that as a result of how the capitalist system functions, and everything that we're talking about is built into that system.
Yeah. Joy, yeah, absolutely. I just want to get the name right, because it's important. It's Gus Bickford is the chair of the Massachusetts Democratic Committee. He's the one who orchestrated the attack against Adam Morse and defended Dick's dickishness. Adam, if you get a chance, I read some while ago, again, dealing with children being harmed, and now in this case, even prenatally. I'd love you to touch on the fact that they're now finding microplastics in placentas. That is something, if you could elaborate on that, I think. Let's talk about the children. If we're talking about the future, my children are just 2, but there are millions of children who are being affected, not only by air pollution, but the microplastics. And Adam, I'd love to hear some of your insight into that.
Yeah, I mean, so I'm a chemist by training, and chemists pride ourselves on our material science and producing these compounds and these polymers that make up plastics that don't degrade. But that means they don't degrade. So when you ingest them, they incorporate into your body's system. And during pregnancy, they will incorporate into the placenta, into your children, and it's a generational pollutant transfer. And it's not just these microplastics, it's the plastic additives, things like bisphenol A, things like UV filters, which strongly mimic estrogen. These are very hydrophobic molecules. It means they're stored in the fat, and thus they persist a lot longer in human bodies, because they'll just stay in our fat stores.
Wow. I'm learning a lot. Andy, is there any way that we can play my 2 Donziger clips now? They seem to really go with what we're discussing. And then I want to environmental things like this also are affecting the poor and people of color. Do you think that it is that way on purpose?
Well, I think it is a reflection of a phenomenon that many call environmental racism. That's for sure. In other words, the worst environmental practices often take place in the poorest communities, often communities of color, in this case, indigenous peoples. You see this all over the United States and really in many places around the world. I mean, for example, Chevron has a refinery in Richmond, California, which is a low-income, diverse, mostly minority community across the bay from San Francisco. And there's like a massive polluting, cancer-causing, like mega gross industrial site where oil is refined, like right in the middle of an urban area. It's crazy. And the level of asthma in that town because of the pollution from Chevron's refinery is off the charts. There was a fire there 10 years ago. 15,000 people had to get medical treatment. 15,000 for breathing, toxic vapors. So that's an example of environmental racism, in my view. And I think what is happening here in Ecuador is another example. And I think people need to sort of look at it through that frame to understand why certain communities in our society pay a much higher cost for environmental damage than others.
question, I just want to ask you about 1881A. Are you familiar with that?
Honestly, I'm not. Can you explain it?
Yes. So basically, it happened in Libby, Montana. There was an environmental crisis, and the town was able to get immediate Medicare full insurance because of it. And Biden has the ability to do an executive order on it, meaning he literally could sign an executive order today to give every single one of us full coverage, and he is not. So I wanted your take on that, on national Medicare for all, what you think it would do for people environmentally who would suddenly have the ability to, go to the doctor and have, medical services from things, that have happened to people like in Flint, things like that, actually have the ability and the means to take care of those things.
He should do that. He should sign that order or those executive orders to deal with the health impacts of environmental crises like Flint and, like
Absolutely.
things that are happening all over the place. I mean, the reality is people are being severely harmed by environmental impacts. Sometimes they don't even know it because it's imperceptible. It's little by little in the water they're drinking or the air they're breathing, food they're eating. But absolutely, I mean, let's just start with the National Health Plan. My golly, every country in the world has one but us. I mean, come on. So many of our problems in America will be solved if we just gave people basic health care. Health care is a right, should not be a privilege. So I would support that. And I think there's so much President Biden could be doing, things like that, to carry out an agenda that meets the needs of the majority of the people of this country. And unfortunately, he's not moving fast enough on a lot of these issues, including the cancellation of student debt, while we're on the subject. So, President Biden needs to release me, needs to take back the prosecution from Chevron. He needs to sign executive orders so people can be treated medically or have their healthcare needs met when they're victims of environmental contamination. And he needs to fight harder for a real national health plan. But again, he's just a piece of it. Ultimately, the power comes from the people, and it's up to us to really do the organizing, the harnessing, and the leveraging.
Donziger, you're a fucking hero. Free Donziger. We stand with you. We love you.
It's heartbreaking to hear him say, release me. I mean, just, jeez.
What an honor. He's such a hero. But, the interesting thing is, for those who, for whatever reason, aren't, knowledgeable about Stephen, the thing is, he helped the indigenous peoples in Ecuador. And the difference between that is that these people are so poor, they don't have doctors for miles and miles and miles. But here's the thing, we do. But our people just can't afford them. So, you're seeing some of the same things happen, but they are poor people and do not have access to any kind of medical care. And we do have the ability to have medical care, but we literally don't have the means. So I do want to discuss 1881A. For those who are watching who may not be familiar with it, I want to make very clear, Biden could sign an executive order literally right now and give all of you 100% coverage, and he is choosing not to do it. So let's be clear. We are watching eugenics of the poor. He doesn't care. Let's just be clear. If he cared, he could take care of it. So first thing, tell him to do it. I don't care if you tweet at him. I don't care if you call him, email him. send freaking pigeon postcards. I don't give a shit. Tell him he needs to do this. This is unnecessary violence. So that's the first thing. But also, I want to get the three of your perspectives on 1881A and the fact that we literally have legislature that could do this immediately. So I guess, Mike, I'm going to start with you as a doctor. What are your thoughts?
I mean, I think that it is completely, there are many explanations for it, but there is no reason why frankly, it's the heart of imperialism in the United States, that there is any reason why healthcare should not be a right. There's really no reason why anywhere in the world healthcare should not be a right. When we're talking about the United States, it's absolutely ridiculous that thus far we continue to have the system that we have in the way that it functions. It does not allow, as a healthcare worker myself, it basically pushes healthcare workers like myself to give more poor care. It's not just like necessarily the access that people have, but in the actual healthcare setting, basically people are funneled through that healthcare setting just like items on an assembly line. They're funneled in and out for a quick financial extraction and sent right back into systems that are harming their health. That's pretty much just the way that the system functions. And we're told, oh, this is part of, like, it falls kind of under the framework of disaster capitalism. Clinics like the clinic that I used to work at, that has Black Lives Matter and all these progressive phrases plastered all over its walls, basically during the pandemic was just telling people, you need to ramp up how fast you're seeing people. Don't push back against the dynamics of how you're seeing people here, because we just need to stay open, all of these types of things. And this is just how our healthcare system functions. So it's completely absolutely, there's no justification for the fact that we do not have a universal healthcare system today. I think that whatever the policy it is, to get to specifically to 1881A, it's clear that again, to get back to what I said before, Democratic politicians like Biden are beholden to the corporate interests. And that's why that nothing has been done thus far. I am personally of the framework that Medicare for all generally, national improved Medicare for all generally, is an initial step. Whether that would be getting people healthcare overall through 1881A or you name it, is an initial step. But I think that what we really need is complete nationalization of the entire healthcare infrastructure, and put it, and particularly it needs to be put under worker control. Yep. That I think that is the ultimate end goal of what needs to happen. The workers in these healthcare industries, that's not just where healthcare is actually being, given. So not just in the clinics and hospitals, but also in the entire healthcare infrastructure. That's the pharmaceutical industrial complex. The whole insurance industrial complex should just be eliminated, because it's a whole parasitic industry. But all of that needs to be nationalized and put under worker control, because really the working class are the only people who can determine what is best needed for the majority of the population. It's not capitalists, it's not the bosses and their interests. And I think that the real key to winning that, whether it's that first step or you name it, is mobilization of the working class. Because I think that that's the way that it's going to come. It's not going to come through asking for, oh, could you please just give us this thing? Because clearly the corporate politicians do not care about giving us these things, or we would have already had them. At the height of a pandemic, it would have already happened. It needs to be demanded and forced through the working class.
Absolutely. And I digress slightly, but you touched on imperialism, and you are so right, because something I say is that, People wonder why we don't have national healthcare system and we don't have free college. Why do people enroll in the military? Free college, free insurance. It's linked, period. I'll go around in a circle. Adam?
Yeah, I just want to respond to something Mike brought up with mobilizing the working class. Joe Biden would not be in office without progressive young organizers. We wouldn't have control of Congress, we wouldn't have control of the Senate without a massive effort from young progressives. And I speak as a part of this generation. I organized with the Sunrise Movement, which really came into effect after being inspired by the Bernie Sanders 2016 campaign and mobilizing to elect Green New Deal progressive champions, the Squad, in 2018. And we showed out for Biden. The Sunrise Movement made over 1 million calls for Biden. And we elected a president and we took control of a Congress and Senate on the mandate of a Green New Deal, on a mandate of Medicare for all, on a mandate and a promise to cancel my student loans, which still hasn't been done. And so beyond just being a moral imperative, the political reality is that the Democratic Party is propped up by the labor and the organizing power of the progressives in the party. And if they want to continue to stay in power, they need to start delivering some of these policies that we're fighting for. Because we're fighting for the policies, we're not fighting for the party. And I've seen this in my friends. If you don't deliver the policies, we're going to abandon the party and we're going to look for alternative means of trying to get to the better future that we're all trying to fight for.
I guess I kind of have to push back on that because Biden never said he was going to do any of those things. And we have 40 years of proof. He does not support Green New Deal, Medicare for all. He legit said he'd veto it. So I think we need to be more realistic than the let's push Biden left. It's not working. And I think that it was sad, quite frankly, to see so many people think that simply getting Trump out of office was going to be some kind of, magical thing, essentially. So we just need to, the power's in us. Let's put it that way. Women's right to vote, human rights, civil rights, LGBTQ, these movements happen from people in the streets, not by electoral politics. So we really, really want to focus, on those things. You're talking to someone with a Bernie tattoo. You're talking to someone who literally picked up and moved to Iowa to volunteer for 5 weeks for him. But at the same time, we cannot count on any politician at all, regardless. And I guess, that kind of goes to you, Nathaniel, because you actually ran for office. And I'm like, you're so wonderful. Why? But you did. And you had a great platform.
Thank you.
So, what's your response on all of this?
Well, going back, I'd like to touch on one thing that Mike said, which really touched a brilliant point. The healthcare system in this country is parasitic. That's the word you use, and I can think of no better term. And what we do with parasites, we purge them from our bodies, right? If we've got worms, we eat papaya seeds. We've got to purge the parasites. I think might be a good way to look at it. And Mike, thank you for describing it as a parasite, because I'd never thought of it that way. But there is no better description of our current healthcare system. In terms of healthcare system, I don't know if you can see, I've got a couple little weird bumps here. There's one here and one here. In October 29th, 2004, I had an accident and I shattered my C2, my C5, and my C6. That meant that I was paralyzed from here down. And when the accident happened, we wrote to the Christopher Reeves Institute, which is a specialist in spinal cord injury, and sent them the x-rays and said, what do we do? And the reply was, we're terribly sorry about your accident, but here is the name of a really good wheelchair company, and we're pretty sure we can get you a discount. That's US healthcare. I walk. I dance badly, but I dance. And I can do all of this because when I had my accident, I wasn't in the US. I was in Italy, which has not perfect, but something equivalent to Medicare for all. And so my 18 months in intensive care, my 12 surgeries, and my 2.5 years of rehab cost me a total of €35, under $40. If that had been treated in this country, first off, they wouldn't have treated me, period. No insurance company would have allowed the treatment. But if for some crazy bureaucratic glitch we managed to get it approved, my children's children would be paying off that debt. And it is not right that this country, in theory, the wealthiest in the world, should allow people to remain handicapped for life or with a permanent disability when there is the technology to fix it. It's just inconceivable. My mom, who is 90, I took my parents in when the pandemic started because they needed a little help. She fell the other week and broke both her wrists. Not a good situation. She had surgery this past Monday. And the doctor said to me, you know, we wouldn't have approved the surgery if she was living on her own. So in our country, our mindset is people are disposable. Had my mother not been living with grandchildren near her, they would have said, she's no longer useful to society, let's not fix her. I mean, how ghoulish can we be to say, all right, you get to stay in a wheelchair. You get to stay with broken arms for life because you're too old. I mean, it is infuriating that this is the situation. And Mike's absolutely right. It's a parasitic society that is, for the sake of greater profits, is allowing this to continue. There is no reason that we should be able to do this. If every other country is doing it, we should have it too, even more so than before, and certainly during a pandemic. Going back on just one earlier topic, when we were talking about the lead poisoning, I tried to get the state records on our house. It took a legal battle. It took thousands of dollars. And then finally we were given the documents which describe the issues on our house. Care to see what those are? And Joy, even with your eyesight, I think you'll be able to see this perfectly well. This is what several $1,000s of legal battle came out to for the state to give us the records on our house.
Wow.
That's it. That's all the information they would give us in our house. It has the page numbers and the date.
Perfect. Very
Yep.
useful.
Yep.
Incredible.
Yeah. In Massachusetts, the progressive state.
Yeah. Well, you got Liz Warren, so
Right.
what a hero.
Just rub it in. Why don't you just here's a little
I know.
salt.
I'm
Thanks.
sorry. But that kind of, makes me think about what I went through. I mean, 2 years ago, I literally woke up without most of my eyesight overnight. Literally. No precursor, no nothing. So in addition to that, just having that trauma exacerbated with, each eye treatment, each eye over $12,000 every 30 days. And it wasn't pre-approved because my diagnosis is so rare and I'm under 55. So they were like, Yeah, I mean, we just kind of, you either need to sign this paper saying you'll pay out of pocket if they deny you, or you just wait. So now the treatments I was getting, my sight will never come back. It's not going to happen. But the treatments was to try to stop it from getting worse. So every day I wake up, it's worse and worse. And 2 years later, now 85% of my sight is gone. And could I have had, more sight longer? Absolutely. Who the hell has $24,000 every 30 days? So, it is violence. People are being put in this situation. It is a hostage situation. If you want to take care of yourself, you risk medical bankruptcy. And I know people are going to say, well, you can apply for charity care. No, I can't. My husband works full time. I was denied. We filed joint taxes. It has nothing. If I was single and lived on my own, but we're married. He works full time. So no, and I have insurance. I still pay thousands of dollars every year for my eye surgeries and my treatments, things like that. Deductibles, copays, all those fun things. So yeah, I guess we'll go back around again. And Mike, as a physician, what have you had people come to you and say, I don't know what to do. I need this. I don't have the means.
Absolutely, all the time. I mean, I've had patients come in many times, for example, elevated blood pressure. We prescribe a blood pressure medication, comes back, the blood pressure is higher, sometimes comes back in what we call their hypertensive urgency or hypertensive emergency, where the blood pressure is so high it can potentially cause problems with other organs, so whether brain, eye, kidney, you name it. And I've had patients basically say, well, it's because it was going to cost X amount at the pharmacy. And it's absolutely disgusting that we live in a society where people have to make that type of choice, where medications might be that much money. And there comes with it this connotation like, okay, so we can, at our clinic, we can find ways to get the medication for cheaper or give it for free or this, that, or the other thing. But because of this dynamic and how it inherently functions, people just feel like I don't even want to go to they feel ashamed. They don't want to even come to speak because of the violence of how this system works. I've had patients where there's pretty good diabetes medications these days, like ones that, for example, I prescribed an injection to a patient that he would just use like once a week, and it brings down the number that looks at the blood sugar called an A1C pretty well. But when he came in, the A1C was even higher, and I talked with him about what's going on. It's because the medication costs X amount, and when you live in a society where people have to make a decision about whether to eat that night or have medication to literally control their blood pressure, you are living in a basically completely like failed state the way that it's working. I mean, it's absolutely ridiculous when you live in a society like that. And when you juxtapose that you live in a society where somebody needs to make a decision whether they're going to eat or take their medication that night, or pay the rent or take their medication that night. And at the same time, actually, I looked this up because I didn't know the number off the top of my head. But Joy, when you were mentioning how much money a month or those types of things, I looked up Jeff Bezos makes $140K a minute. When you live in a society where somebody makes $140K a minute, and when you live in a world where the wealthiest basically increase their wealth by, I think it was like $3 or $5 trillion just during the pandemic alone, as millions of people died because capitalist governments around the world made decisions to keep industries open, to not pay people to stay home, to not give paid leave, to not do all of those things, because the continued profits of the ruling class is more important than the lives of millions of working class people. When you live in a society like that, and when you live in a system like that, that system's got to go. So not just the healthcare system, the way that it functions, where people have to decide between food, rent, you name it, that healthcare system's got to go, because we should not accept a healthcare system to function that way, but we should also not accept an economic system that's destroying the only planet we have to live on, and that's continuing to kill people, continuing to cause the wars that we see right now around the world, destabilize governments around the world, and then that contributes to the ongoing climate destruction that Adam and others were talking about. That system itself has got to go.
Absolutely. And, speaking of Bezos, not even his employees have good health care. That's what's insane. Like, even if people say it's a false equivalency to say, well, he makes all that money and we don't have health care because it's not related. Dude, his people literally do not have good health care. So it is related. Adam, I was sent this article, and I want to get your take on it. It's by Newsweek, and of course I won't read the whole thing, but the title kind of sums it up. About 200,000 Americans die every year from air pollution. This is insane. I didn't realize those numbers were so huge. And I can send the link, and we could put it in the comments. But yeah, what's your response to that? I didn't realize. I knew a lot of people got sick, but 200,000 deaths every year.
8 million globally. It's the emerging health threat of our time, is airborne exposure to these pollutants. About half of it's outside. That's your typical urban smog. If you live in a city, you're more likely to develop asthma, die earlier, and half of it's indoors. It's from methane-powered stovetops. If you cook with a gas stovetop, you're emitting methane gas into your house. You're emitting particulate matter. You're emitting nitrous oxides, with completely deleterious public health impacts, which go on to make you more at risk to further respiratory disease. And so we live in a country where a population is poisoned, and there's no way to treat a population comprehensively without single-payer Medicare for all. Because a lot of these health impacts, you can catch them early, you can treat them, you can do preventative and restorative medicine, but that's not how a medical system is set up. It's cliche, but it's a sick care system. It's not a healthcare system. It's completely reactionary. And so without comprehensive early detection of the accumulation of these pollutants in your bloodstream, getting standard panels regularly, getting comprehensive panels, and also just having a society and economy designed around, when you identify these exposures, removing them. Not a society that's going to sue you or try to take your kids away for being in a home with lead exposure, but a society that'll replace the lead pipes, a society that will give you housing as a human right, and help you transition to a safe location. I don't see that, but I think that's the society we all need to build together.
And that brings up a good point. Like, even if we considered performative, other countries have at least declared a climate emergency. The United States has not even so much as done that, which is alarming, but I think it's kind of obvious the reason they haven't done that is because then they're going to have to actually do something to act on it. So, and also, I mean, Biden fell asleep during the climate conference, so that's not really exciting. So I guess I'll continue going around. Nathaniel.
Yeah. So I mean, falling asleep was embarrassing, but let's be real. What was worse is increasing the number of drillings days after the COP26 conference. You know, the drilling he has permitted is the highest ever. Not Trump, Biden, and he did it days after his commitment to the Paris Climate Agreement. Just disgusting, just disgusting. In terms of environmental racism, the issues in terms of lead poisoning is most often in older homes that have not been remediated. Those are usually in lower income neighborhoods. Those are unfortunately usually more racially diverse neighborhoods. And when you think about the people who are living in those situations, that means they are the most likely to have lead poisoned children. And the treatment for lead poisoned children, we didn't touch on it, is $3,000 per week per child. The minimum is 1 year of treatment. Realistically, you need 2 years of treatment. So we are saying the people in the very poorest neighborhoods and the most diverse neighborhoods, we are going to saddle with a bill of $12,000 a month per child. I mean, it's just disgusting. In terms of the indoor air pollution that Adam touched on, that's actually the foundation of why my company started back in '99. So my company, half of the world's population cooks on open fires, the famous 3-rock stove. So basically 3 rocks, some sticks underneath, and a pot on top. And those are usually indoors and usually without a chimney. The highest amount of it is the highest rate of death, usually among women and children who are then attached to the moms as they're cooking. So we work on clean cooking solutions which have lower or no emissions and address global health issues. It's 3 billion people every day are exposed to that sort of indoor air pollution. It's just horrific. In terms of the climate crisis that we're not addressing, drilling is not the answer to addressing our energy needs. And even if we stopped all fossil fuel production and use today with a magic switch, because of existing CO2 levels in the atmosphere, global temperatures will increase for 100 to 1,000 years. So any of these goals that Biden's talking about of 2035, 2050 are absolutely just smoke in your eyes, quite literally, not just the toxic type, but the verbal type. And this means that if we're going to address these things, we have to start talking about correcting past mistakes. And we, as the nation that has done the most harm globally, yes, China is surpassing us now, but cumulatively, nobody comes close to us. We have the greatest responsibility in bringing down existing atmospheric CO2 levels. So the issues right now, our administration is accelerating climate change, the current administration, and anything they talk about for green deals, green promises, green anything, it's just a lie. You know, a goal of 2035 means we've missed the tipping point. A goal of 2050 is just laughable. If we want something to really, really happen right now, we need commitments of, okay, 2024, we will do this by 2024. The current administration has that authority. They won't after, because let's face it, the midterms are going to be disastrous. They're going to be an absolute bloodshed everywhere. So Biden's administration will only have any authority until 2024. And even after January of this coming year, we won't have much power because we won't have control of the House. We won't have control of the Senate. They've done everything they can to lose desperately and gloriously. I mean, if somebody had to write a play on how to lose the midterms, they would have been the best play, the best game, because they've really done everything you need to catastrophically lose. So, Adam, I'm glad you're part of Sunrise. Sunrise is something that I really believe in. I've been to many, many, many Sunrise meetings, and until the pandemic, was a monthly attendee. I think they're great. They endorsed my congressional campaign, and I'm glad you mentioned that I did run for Congress, despite the fact that twice during my campaign the Democratic Party disenrolled me without telling me. So, whee!
But you're still fighting. That's what matters.
Yes.
As
Well,
trite as it sounds, you are a fighter, and that's why I had to have you on this panel.
we have
So
to keep.
I guess, and I don't want to ask this question to be defeatist. I just want people to understand the severity. I want to go around and have each of you explain from your perspective where you think we are going if we do not have national improved Medicare for all. Where are we going? And yes, I agree with Mike. It is the floor. We need way more than that, but this is the floor. So each of you, please, address where you think we're going if we don't get this like now. Mike, I'll start with you and go around again.
Okay. Are you also okay if I quickly comment on the last question and then answer your question? So, and the reason why I wanted to comment on the last question, just a couple quick things about the ecological crisis that we're facing. I previously talked about, individualizing illness and those types of things. I think also a lot of the responses to the pending ecological crisis have been, there's an attempt to individualize those. The recycle more, we just gotta get your green, go buy your Tesla, and that's the solution, those types of things. And I think an important thing for everybody listening to hear is just how that idea is completely bankrupt, because a majority of the admissions, 70+%, are from the top 100 companies in the world. So a majority of what we're seeing is from the top companies in the world. And then this other specific thing that I wanted to make in connection to imperialism is the fact that the US military is the top polluter in the entire world. So we are not going to actually confront the ecological crisis that we're facing unless we confront US imperialism, because the US military is continuing to basically destroy the world. And in that vein, I think it's super ironic that recently, just goes back to how bankrupt the Democratic Party is, that bill that was voted on, going back to the pandemic, funding for the pandemic was cut, when meanwhile continued funding for the military was approved. Lenin talked about imperialism being the highest stage of capitalism. And I think that unless we actually confront the imperialist system, we aren't going to, and particularly at the heart of the imperialism, the US military, we aren't going to confront the ecological crisis that we're facing. To answer the question of where we're going, if we don't achieve Medicare for all, I think that we're going to continue to see even further what we're seeing now, which is people not receiving the type of healthcare that they need. Insurance companies are already denying chronic reimbursement for chronic medications. They're already denying paying for people's healthcare. We're going to continue to see that. And nobody should have the delusion that COVID, not that even COVID's over, but that COVID is the only pandemic that we're going to see. As we continue to destroy the environment and continue to encroach on remote areas of nature, we're going to continue to see different types of viruses, or you name it, jump from different animals or plants or the environment to humans. And then we're going to see them spread along the networks of capitalism and go globally. And I am waiting for the time with fear that we're going to see another, illness jump, and hopefully it does not have a higher mortality rate. It does not have a rate of mortality like Ebola or something like that and go global, because we've seen that the ruling class is completely unwilling to address the pandemics like that, and that the capitalist system is completely unable to address the outcomes of the crises that it creates. Instead, what the ruling class is doing right now, I think Nathaniel was talking about this a little bit before, the capitalists see the writing on the wall. They are building bunkers and those types of things because they know that shit's going to hit the fan. So that's why we're having space launch explorations and building bunkers. I think that the only solution is for the working class internationally to mobilize and push back against this system, because pushing back against the system will also help us to achieve the type of healthcare system that we need in the United States and other parts of the world.
Absolutely. And, you are so right about imperialism. And I want people to, I've actually read much of the Build Back Better bill. It's 2,700 pages, so not entirely. But I want people to understand that was so much of breadcrumbs in that. It was nothing. And on this topic, it had even billions more to our military. So even having the highest military budget, the defense budget, in history, they want to give even more. And yes, it is our biggest polluter without question. So yeah, if you are for the environment, you need to be anti-imperialism. They go hand in hand. Adam.
Yeah, just to join in on the U.S. military, that they're the cause of a lot of environmental crises in San Diego, where I live. Marine planes land next to a school I work with, and we track the particle counts of the leaded gasoline that they're using, emitting like localized air pollution and airborne exposure to lead. Navy ships are also polluting San Diego Bay, and really impacting the worst brunt of air pollution is in Barrio Logan, right next to that port. And yeah, we need to confront all crises at the same time. We need to confront capitalism. We need to confront imperialism. We need to confront the healthcare crisis. We need to confront the climate crisis. Because inherently, capitalism is extractive. We extract the earth and we get untold amounts of pollution. We extract the labor and we get defeated and we get a sick pool of people. And we extract healthcare and we get deaths in our healthcare system when folks are underserved. And I agree with Mike. I think the only thing that's going to change this is people power in the streets, inspiring change and showing that we know enough is enough and we're not going to stand for these systems of oppression any longer.
Absolutely. Nathaniel?
Yeah, so I'm sorry I kept flicking out the power.
Okay.
We had a power loss, but in any event, yeah, in terms of where I see us heading right now, if we don't change things, first and foremost, I see eugenics as being the game plan. The fact that people of color and the disabled are the most critically affected by the COVID pandemic. It is eugenics, and more people need to be calling it that. Secondly, in terms of military spending, only 15 members of Congress voted against the latest budget. Only 15. No change is going to come with 15 votes. We need complete revolution in terms of that. And if we want to really talk about national security, I've been toying with for years is, all right, right now we're at $770 billion in annual expenses. If we took $770 billion and turned that into humanitarian aid and environmental remediation, not only would we save the planet, but we would be the most loved country in the world. Nobody is going to attack the country that is feeding every nation in the world. Nobody is going to attack us. At that point, you are increasing national security more than any bomb will ever do. I happen to think that doing good will make us safer than having massive arsenals. And just the fact that our nuclear weapons issues, nobody should have nuclear weapons, but the fact that we have them, the cost of just keeping them stable and not dangerous is greater than the cost. One of those bombs is greater than the national cost of some nations for everything. So we are just bleeding money, which we could be using for far better good in this world. Those are the things I see that we really need to focus on. And with only 15 people in Congress willing to vote against that, I don't see any change happening soon unless we really, really ramp up the political efforts. And Sunrise, kudos to you, because you've been far more effective than Justice Democrats. You've been far more effective than all these other groups that claim to be progressive. And the way you're being effective is, I think, the only way that's going to change it, which is you are getting people at the lowest, smallest offices elected as well. And so you are taking a page out of, and I hate to use this phrase, but you were using the evil that was done by the Tea Party and doing it for good. You know, getting people elected on school boards and planning commissions and all the way up is how we're going to get that change, because we can't count from the top down at all.
So unfortunately, we are like at time, but I really wish this conversation was like 5 hours.
Yeah.
I feel you guys are awesome. I do just want to give you guys one last word. If you have like a lasting thought you want people to take away, and then also where people can find you, if you have a Twitter or website, anything like that. So we'll go around again, Mike.
Crap, I don't know my Twitter off the top of my head. Maybe somebody can put it in the chat.
Yeah.
But let me just say what I was going to say, and then I'll try to say my Twitter. I think that the lasting thought that I would try to impart is it's important. We need to view things as a battle of classes here, a battle of the working class versus the capitalist class. Whether it's like healthcare workers or other work sectors, need to find militant modes of combat, whether it's through union activism, but in that, like, fighting for broad union democracy and fighting against democratic bureaucracies that betray union militancy. But I think in general, workers need their own organizations to organize in their workplaces, to organize globally, to push back against these types of systems. I think that that's kind of my lasting thing. We write a lot about this at Left Voiced. You can find my writing at leftvoiced.org. I encourage others to follow us, write for us, engage with us in our international. I think my Twitter is something like Dr. M. Pappas or something like that. But I think it's also written on the Left Voice website.
I just typed in your first and last name and it came up when I was searching for you.
There we go.
That's the easiest way. Adam, how about yourself?
Yeah, so I joined the Sunrise Movement for the ethos of militant optimism and radical joy, and envisioning the better world that we think is possible, and then fighting like hell to get it. And so I think it is important for our mental healths and for sustainable organizing to always hold that better future in our minds and not get too bogged down in the crises we face, because they're scary. They're existential threats. And it's easy to get lost in despair. And so I'd recommend, like, anyone watching, if you're not already organizing, organize with a group of like-minded individuals, organize at work with your labor, organize with your passions, and join together, because individual actions won't produce societal shifts. It's only through collective action with groups of dedicated, talented people that we're going to win the battles that we need to get won. You can follow me on Twitter at Chem Cooper. So CHEM and then my last name, Cooper.
And Nathaniel.
Great. I agree. And Mike, your Twitter is DRM underscore Pappas.
Thank you.
So, you're welcome. My Twitter, by the way, is a voice for the number 4 MA and then the number 6. So yeah, my lasting thought on this is I'd like to agree with Adam. We have to be aggressively optimistic, because if we're not, there's no way we're going to have the energy it takes to fix anything. Clinging to those threads of optimism is vital. Getting more and more young people involved, maybe get the voting age reduced to 16, where people's minds aren't yet corrupted by the establishment, would be a big way to help the world. And transparency of government. You know, again, not to complain constantly about my state, but Massachusetts is the least transparent state in the nation, the only state where the entire legislative body is exempt from Freedom of Information Act requests. So, you're right, in darkness, right? So yeah, optimism, transparency, and get the youth involved, and I think we have a chance of doing something good. If not, you know, let's hope passports are still valid, because, but the problem is these problems are global. You know, we can't run away from them. There is no fixing the entire planet and saying, well, I'm just going to go live in this one place. It's nice, because atmosphere is all connected. The pollution is all connected. The temperatures are all connected. So let's follow Adam's good advice and be aggressively optimistic going forward. In terms of this meeting, I too think it should have been 5 hours. I would have far preferred it being around the table. I love cooking for people. Come over. If you don't mind Italian food, I'll make you all 10 pounds fatter.